Hello, social services and nursing team for the main building. My name is Tyler, and I am a University of Indianapolis student who is studying occupational therapy. I am here at Compass Park for my last semester to develop a program aimed at increasing the acceptance of IL residents to start a therapy program. But secondly, I wanted to provide education on a protocol called spikes. This is a protocol that I believe will serve you well, as it is a well-studied method to deliver disheartening information in the medical field. As mentioned, the spikes protocol is a method that you and your team may utilize in order to deliver disheartening information to your residents. For instance, when a resident demonstrates decreased safety and functionality within their current environment, they may need to be transitioned to a more intense level of care, IL to AL, and possibly to SNF. Nobody wants to move from their home, even if it is secondary to safety concerns. So this may cause the resident to become frustrated and even upset about their current predicament. The spikes protocol is a strategy for breaking the bad news to individuals, which aims to gather information, provide support, collaborate with the resident to alleviate any unregulated emotions, and increase their acceptance. Now, you may already be practicing some of these guidelines, but here is a concrete method that you can be confident in following. The first step in the spikes protocol is S. This stands for setting. You want to arrange privacy and involve significant others if needed or if requested, if the resident agrees to it. Make an initial connection with the resident and establish a rapport before breaking the ice. The second step is P, which stands for perception. The resident's perception of their condition and seriousness of their condition. Here you want to inquire if the resident already understands their current condition or what they're currently suspecting. Listen to the resident and hear out what their current comprehension is of their abilities as well. This is important now. Accept denial, but do not confront the resident in this stage. The third step is I, which stands for invitation. Receive an invitation from the resident to provide any information. In this step, you ask the resident if they wish to understand any details of their current condition. If the resident does not wish to know, accept their right to not know. Lastly, offer to answer any questions that the resident may have. The fourth step is K. This stands for knowledge, providing medical facts to the resident. If the resident does wish to understand their current condition, make sure to use layman's terms when communicating to the resident. Consider their educational and socio-cultural background, as well as their current emotional state. Deliver information in small chunks. In between delivering these bits and pieces of information, check in with the resident to see if they understood what you have reported. Respond accordingly to the resident's reactions as they occur in the moment. Provide any positive aspects of their condition first. For instance, explain what they're doing that is positive for their well-being. Provide accurate and relative facts about treatment options, such as therapy. The fifth step is E, which stands for providing an empathetic response. In this step, you need to identify the emotions being expressed by the resident. Are they saddened, in shock, anger, silent? Secondly, identify the cause of these emotions. Are they expressing this emotion because they may have to move from their residency? Or is it because they are coming to terms with their current condition? There may be other reasons that you can identify in the moment aside from those two. Give the resident time to express their feelings, then respond in a way that is appropriate and demonstrates that you have recognized the connection between the emotion and the cause. The last step in the Spikes protocol is S. This stands for strategy and summary. Here you want to close out the conversation. Ask the resident whether they need clarification on anything. Offer an agenda for the next potential meeting if applicable. For example, I will speak to you again when we find a suitable home for yourself. That is all for the Spikes protocol. I hope you found this information easy to understand and you may be able to use it in future practices. Again, I'm Tyler, and I thank you for watching and listening.